So we take stock again. South Africa has more than 7 million people living with HIV. There have been successes and challenges. South Africa has achieved the largest rollout of ARVs anywhere in the world. But the United States earlier warned it could cut funding for HIV treatment by more than 5 billion rand, saying the fight against AIDS has been grossly suboptimal. For example, the number of people who start taking life-saving drugs and then don't continue is rising. Well, the 9th SA AIDS conference has been held in Durban. Deputy President David Mabuza is also the chair of the SA National AIDS Council that brings together government and the private sector, delivered the closing address today. To discuss, we're joined by our reporter Mlungisi Khumalo on the line. Mlungisi, welcome. What did the Deputy President have to say?
Thank you very much, Francis. A good evening to our viewers at home, and as well a good evening to you, to Francis. Yes, look, today was somewhat of a gloomy day for South Africa, if one can almost put it like that. Deputy President David Mabuza had the opportunity to close the 3-day AIDS conference, which was held in Durban. And over the last 3 days, there's been some extremely interesting discussions around the whole issue of fighting AIDS throughout sub-Saharan Africa. And what I can confirm and tell you today is that, unfortunately, figures of infections have not changed in South Africa. In fact, one of the sad numbers that we got through today was that currently in South Africa there are 7.9 people that are infected with the virus, but just only 4.4 million people are actually taking their treatment. Now, you also recall that in the year 2013, the World Health Organization came up with this 1990 strategy. Now, how this 1990 strategy goes is that by the year 2020, throughout the whole entire globe, we should have at least 90% people knowing their status, 90% of people who are taking their ARVs, and of course 90% of people who have their viral load suppressed. But unfortunately, we are still, however, lagging behind. And this is what the Deputy President had to say today. He did, in fact, mention that he was extremely and grossly disappointed that as a country, not enough was being done to try and fight the spread of the HIV and AIDS virus. And as you recall there, Francis, is that just a week alone, we have 1,200 young girls between the age of 14 and 25 who are infected weekly. And of course, Deputy President David Mabuza went as far as saying that a year alone, we've got 2,500 people that are infected with also this virus as well. And that is where he actually urged professionals within the science sector and within the medical center, saying that we were in dire straits when it comes to this virus. And of course, funding in terms of fighting this virus was also drying out. You also recall that the U.S. actually cut funding, because you also recall that when it comes to fighting the HIV and AIDS virus in sub-Saharan Africa, to be much more precise, most of the funding actually comes from overseas. Yeah. So these were some of the very alarming figures. And just lastly, Francis, we also recall that yesterday there was also a panel discussion which also gave us some staggering figures whereby they said that in the mining sector alone, over 80% of some of the workers that work underneath the ground are actually HIV infected with the virus, and a lot of them were now, as a result, suffering from TB because men were not testing as a result of that. And also mentioned yesterday through the panel discussion that unfortunately, men in Africa and throughout the rest of the world were scared of going out to test for the virus.
Mlungisi, talk about what he was talking about in terms of solutions, saying we need people on ARV, we know it saves lives, another 2 million more. Very quickly, when could that be achieved by?
Okay, he said by 2020, of course, many of the people that were there, in fact, I had an opportunity to speak to one of the professors who were there. They actually said to us, it is a very, very ambitious task to do by 2020. Look, we're almost 6 months before 2020 and already only have 4.4 people that actually taking their ARVs. But quite interesting enough there, Francis, David Mabuza also mentioned that if these 2 million more people actually take their ARVs, this was also going to burden their already troubled state health system there, Francis. So look, it's going to be a very ambitious task, but hopefully government says they do have plans in place to try and ensure that they add 2 million more people into the ARV program.
All right, thank you very much, Mlungisi Khumalo. So a lot of challenges still, and worryingly, as we said in our question of the day, the infection rates among young people don't seem to be budging, don't seem to be coming down. Tell us your views.